John Gardner was the secretary. My office was right next to his, and so I began to get very much involved, first of all, in developing policies. The most important of those, one was health manpower, prescription drugs. I chaired a task force on prescription drugs. I was very much involved in desegregating 1,000 hospitals with Medicare money. I wasn't in charge of it, but I was very much involved in that. So I'd gotten very much involved in health policy. So then I was going to be out of the chancellor job by the fall of '72, and that's when Lou and I first started. We were both very dissatisfied when we asked people in universities, was there any new ideas? No new ideas. I mean, it was pitiful. And the only people doing anything on policy were economists.
And Phil, before he steps down as the chancellor, gets 1326 3rd Avenue, a house that we could go into, and lines up all the kinds of things. And it wasn't until I got there that I realized that that Phil had been a revolutionary as chancellor, because suddenly there were women getting into the medical school and there were Latinos getting into the medical school.
Yeah.
People at the Institute were always in touch with what were health policy issues at local, state, and federal government that decision makers were confronting.
IHPS, when it started out as the health policy program, was deeply connected to Washington. Then those of us who came in sort of in the second generation behaved more like classic researchers. We generated interesting projects, we got funded, we did our stuff. What then happened is a closer connection between the researchers and the generators of data, the people who have the problems, the people who can actually use it.
The world of policy making today is very different from 20 or 30 years ago. 20 or 30 years ago, most policymakers didn't have very many people as researchers, and certainly not institutions to turn for the kind of guidance you can get from the Institute.
This is a powerhouse institution that creates a lot of really rigorous work on a number of very important health policy topics.
IHPS was doing translational research before that word was even defined within the research lexicon. Long before it was on the NIH map as something that we needed to do, IHPS was doing translational research, but not just research from, as we come to understand it, from the bench to the bedside, but from my standpoint as a sociologist, critically important is translation from into the community.
There were people with different disciplines who thought of things differently, and we cross-fertilized each other. That made it possible, I think, for us to be more successful in getting grants and more successful in getting papers published in premier journals, because we had a perspective that was not just the narrow discipline of our own interest.
The economists were there, the docs were there, you know, the nurses were there, and yet people felt like they were on equal footing.
The Institute is a very inclusive place.
I think the biggest thing is the mix of disciplines that sit right together at IHPS, and no one is sort of identified as whatever discipline they come from.
One of the things that the experience introduced me to was that the incredible generosity of not just the faculty at the Institute, but of the individuals they introduced me to.
We had sociologists, economists, people from other fields within medicine, all in the room, all looking and talking about some of the same issues, but always from a different perspective. And in doing so, I felt that my world kind of opened up.
We have very interesting meetings where the group gets together and we go over whatever it is the mentee of the month selects, and they decide what it is that they want to do. So it's a mentees meeting, and the mentees plural with an apostrophe after it because it belongs to them. What I think we do particularly well at IHPS is see the individual and realize that each person has a set of goals that In any research unit, they vary, but in a place like IHPS, they vary more than most units.
We've been working hard to think about how to take the vision for training that Phil Lee and Hal Luft and Claire Brindis have articulated and supported for many decades, how to make that relevant for our current times.
We're working very closely with IHPS on the development of the health policy and law degree, which is proposed to, we hope, begin in 2014. And that degree will actually be jointly conferred by UCSF and UC Hastings, and it's a true collaborative effort.
Because of course it's very gratifying to think that some analysis that we did at some computers here in San Francisco might be helping decision makers in Washington or in Nairobi or wherever.
When I got involved at the Health Policy Institute, industry was making literally billions of dollars and denying health care indiscriminately to children with cancer. It was outrageous.
I was in San Francisco when the AIDS epidemic basically was first recognized, so that the combination of the health policy exposure early and the clinical exposure to those very first cases of HIV were very powerful. So I ended up going into epidemiology and public health with a focus on HIV prevention.
We did some work that we led here at IHPS with several other medical centers, trying to understand the costs and clinical outcomes associated with orthopedic surgery that led to major payment changes in the Medicare payment system.
We are working to expand our research beyond the Institute and UCSF to introduce this concept in the Athena Breast Health Network, which is a network of the 5 UC medical centers.
Let me explain what the Patient Support Corps is. It's this concept where we're using students who are in different training programs, whether they're medical students or nursing students or public health students or even undergraduate students. And so when you think about it, who's better than a student to help you connect with good information, like online sources of good information, or help you generate a list of questions or take notes for you at an appointment. We're starting right here at UCSF, and then we've also recruited Dartmouth to be the next outpost.
I was able to create something that was meaningful for the most underserved populations in this country and worldwide, which are, at my personal point of view, the immigrant population.
What if there had not been an Institute for Health Policy Studies? And the truth is, I sort of tremble when I think about the individuals that would not have come into my life, as well as the possibility and distinct possibility that I might not be in medicine, in any field of medicine, because at a critical time for me, when I was trying to find my way, the Institute was there to turn the light on.